It's another week of COVID-19, Kun Thepchai, and the whole week it seems the confirmed new cases in Thailand has been slowing down a bit. And today, confirmed new cases in Thailand are 15. Shall we say another good news?
No, even though we have been repeatedly cautioned by medical authorities not to be too optimistic, but when we see these figures today, we can't help but telling ourselves that we are doing quite well in containing the virus. So today's figures, 15 new cases, certainly is another piece of good news.
No new death today, no fatality. So that is quite on a good trend, positive trend in Thailand. But again, we have been told in the past 2 weeks that the guard has to remain very high. We still have to remain very vigilant. And as of now, there is no confirmation of relaxation of lockdown or state of emergency extension, which we still have to follow up with the Prime Minister's decision.
Yeah,
Which should
definitely the talk of the town this day is when or how the restriction will be eased. And of course, we all know that we have been under a so-called lockdown for a month now. So when the state of emergency officially expires early next week, then a lot of people are expecting that it would be eased somehow. But from all indications we have been getting from the government house, it looks like the government is most likely to extend the state of emergency for another period of time. But of course, we expect to see some easing of some of the stringent measures to make life easier for many people in Bangkok and other cities.
Timing is quite crucial, Kun Thepchai, because Dr. Thavisin, spokesperson of Center of COVID-19 Situation Administration, CSSA, tell us all the time that what happened today is the result of the past 7 days or the past 14 days. So I think they have to be monitoring the figure quite closely, especially on the 30th of April, because it will be the result of what happened on Songkran Day. And it's quite crucial day because it's the expired day of the state of emergency. So next week, they will have a special meeting with Prime Minister Prayut Chan-o-cha, and then we will know what's going to happen on Tuesday in the cabinet meeting.
No, it's understandable why Dr. Thavisin has to say this every day, that we need to be patient, we need to sort of keep our guard high, and then we are not there yet, because there has been increasing clamoring from many quarters in the society for the restrictions to be eased. Even opposition politicians are now, adding their voice to the growing calls for the government, even to lift the state of emergency. Some of them have gone to the extent of saying that the country no longer needs a state of emergency and we can handle the pandemic without it. So that's why the medical authorities need to come out and ask people to be more cautious, not to be too complacent, because the figures, even though they have been coming down consistently, that do not represent a sort of a breakthrough or a success in the fight against the virus.
Internal pressure is quite significant and understandable at the same time, because right now it's dilemma between public health control, try to control the situation of infection, but on the other hand, economic community and economic activity must have wanted to resume back to business as usual. But as we have been told that public health has been working quite very, very hard to control the situation of infection. And very interesting figure today is also about the test that right now all over Thailand we have 123 labs around the country to test of the infection cases. And the capacity that they can do this day is about 20,000 tests a day to test whether people are infected with COVID-19. So we can see clear development in terms of testing in Thailand as well, Kun Thepchai.
Yeah, the medical doctors have been insisting that the testing that has been carried out in Thailand has been effective, comprehensive, and professionally done. So they try to dispute the question that we have not done enough testing, and that's why the figures of infections has been kept so low. So this is the opinions of those who question the effectiveness of the testing. But if you talk to the medical authorities, they would say that we have done a rather professional job and very effectively in making sure that testing is done among people who are supposed to represent groups of people that could be subject to a potential infection. So that's why Dr. Thavisin has been saying this out loud every day about this testing issue.
And the second wave, when we heard of this, it's another story that we have been warned as well, that we need to keep looking at the situation of other countries surrounding Thailand, especially Singapore, Malaysia, Indonesia, in which they have more reports of more new confirmed cases. Especially in Singapore, the country that we have been mentioned 2-3 days already, Kunthepchai, that the number of new infection cases is surpassing 1,000 cases each day. And right now, total infection in Singapore is beyond 10,000 cases.
Yeah. That one major reason why medical authorities are not too anxious in seeing the economy or social activities reopened at this juncture. They would rather wait until we are certain that we have had the virus under control. I mean, what happened in Singapore, for example, in Malaysia, or even Indonesia, where the so-called second waves of the infections have emerged, are serving as a good reminder for Thailand. And of course, it should also remind many of those who have been calling for an abrupt and a quick lifting of the restrictions, that things will not be as rosy as they want to see, because we have listened to learn from our neighboring countries.
Yes, and I think that is part of crucial factor that Thai government will have to take into consideration whether to relax lockdown measures in Thailand anytime soon. But we have got reports that Thailand's northeastern province like Buriram and eastern coastal province like Chonburi are considering to ease lockdown measure in the two provinces. And it may probably begin on the 1st of May, Kunthepchai. So at least these two provinces are considering to relax the lockdown measures.
So at least two provinces, as Kunnatha mentioned, Buriram in the northeast and Chonburi on the eastern seaboard, are set to relax some of the restrictions. Of course, the state of emergency still applies because it applies to the whole country anyway, the law. But there are certain activities that the local authorities can bring up for review. For example, in Buriram, the governor said today that they will try to lift restrictions on some of the commercial activities. For example, like food stalls on pavements and free markets, fresh markets, where people can go and buy fresh food. But this will be done under strict control. And of course, the social distancing practice will be strictly observed. So these are some of the areas in which we will see some restrictions. I believe that more than not only Buriram and Chonburi, many other provinces are in the process of considering easing restrictions in the same manner. It's a matter of announcing them. But of course, the big picture, the government certainly wants to maintain it to be this way. The continued imposition of the state of emergency, and certainly the hours of the curfew are unlikely to be lifted. But of course, there will be easing of some of the restrictions.
Especially in Bangkok, all the restrictive measures must still remain as of now, because Bangkok is still the highest case of cluster of infection. So all the type measure probably still have to be maintained in Bangkok. So in terms of timing, next week, we have to wait until Monday when Security Council will call for a special meeting with Prime Minister to review all the situation and make the decision. So we probably will know on Monday because whatever the decision they will be making, it will have to be in the cabinet meeting on Tuesday, whether to extend the lockdown or what are the measures that they want to relax or to keep it as it is, like what we see at the moment.